Dr. Moeng, welcome to 50/50 and thank you for joining us here.
It's my privilege to be part of this discussion. It's a very fascinating topic.
As a trauma surgeon, what type of snake bites do you deal with on a regular basis?
We see different things. We see different types. Most of the times when people will come in, it will be due to venomous snake bites. Most of what we see in the country will be related to injuries around the limbs, but we've also seen some of the cases where they've involved their nervous system. We've also seen some of the bites where there has been involvement of the clotting problems. And we had to deal with those essentially three groups of snake bites.
Yeah. This particular snake that these people are handling in this insert is the rinkhouse. What kind of damage can it cause?
Sure. Number one, it has a mixture of venoms, but one of the most predominant one, it's what we call the cytotoxic, which causes a lot of tissue damage. So as it bites you, the venom will get into the area that it has bitten, and as a result causes a lot of swelling, a lot of tissue destruction, and depending on the amount of venom and other things that we might have done or have not been done right, that may end up with a potential loss of a limb that has been bitten.
Sure, that sounds very severe. How do you treat a victim like that has been bitten by this particular snake?
Okay, first and foremost, let's start at the scene. Do not panic. There are a couple of things that you must not do because they will worsen the impact of the venom. For example, don't put a tourniquet, because all you're doing when you're doing the tourniquet is that you're concentrating the amount of toxin or the amount of venom on that limb. Do not start running, okay? Because again, as you start running, you're increasing your heart rate, you're making sure that it spreads very, very quickly. And if you've put anything, it must be just a gentle dressing. And after that, try not to move that limb too much. But from the side of the injury, just find out how much of a swelling takes place, because for us, one of our crude indicators would be the quicker the swelling and the more it extends to higher joints, the more likelihood that the amount of venom that has been injected has been of significant level. And we use those guidelines on how progressive the swelling goes to decide on whether we should give somebody an antivenom. This antivenom is a generalized antivenom. It's important that it must be covering and it must be a snake that is coming from this country.
In South Africa in general, how well equipped are our hospitals and clinics to deal with snake bites?
In general, we tend to concentrate, especially the more difficult ones, the ones that will cause muscle injuries, the ones that will cause nerve injuries. We tend to send them to specialized centers, and those are much more fewer. Earlier, smaller bites can be managed at the primary level, but the more advanced, if you're not going to be able to breathe, you need to have a system that can support your breathing, and you need to be able to present there early enough. Then you'll be able to call on and organize the antivenom.
The specialized centers that you refer to, where are they mostly concentrated? Because I would imagine that people in rural areas are probably more prone to be snake bite victims.
Most of the health workers that have been trained in this country should be able to do the primary management of stuff, to be able to realize that somebody's not breathing, to be able to start initiating the transfer to the other center. But long-term definitive care, most unfortunately will be taken care of in bigger cities.
Is there sort of a general antivenom for most snake bites, or do you get specific venoms for specific snakes?
Majority of the cytotoxic snakes, we have what we call a polyvalent. It's easily available and can be found in most of the centers. The difficult one is the snake bite that interferes with your clotting ability. And as a result, you can easily bleed into the brain, bleed into the tissues, and even potentially die from bleeding complication. And that is the one that is much more difficult to find because it is only held in one center in this country. But please be careful that if you bring a snake from another country and it bites you, we may not necessarily have the antivenom for you.
Can you give us an example of a particular case study that was perhaps, particularly challenging for you to treat?
I think one of them is like a straightforward snake bite that is supposed to cause swelling on the limb, and in this case it happened to have bitten somebody on the neck. So what did that mean? It meant that the swelling around the neck was compromising his airway, and we really, really needed to act very quickly to make sure that we don't lose that patient from suffocating because of this swelling that is compressing his airway. What was more challenging again, it was again a snake that is not available in the country. So to try and organize that antivenom was a very, 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 very long process, but ultimately we did.
Would you discourage amateur handlers, snake handlers, to do what they do?
Absolutely. I think there's more to snakes than their beauty. And unfortunately, you might be bitten at a place where you get a lot of venom and you don't get immediate help. And that might mean that it is a threat to your life and you might die. And again, if you need to follow the regulations, there are laws, you need to be taught how to handle them, how to keep other people safe. It's not just about you, it's about other people that might actually end up close to you, and the snake just changes its mind, and suddenly a snake that you've been petting for a while becomes a dangerous snake to someone else.
Dr. Moeng, thank you very much for imparting your knowledge with us. We really appreciate it, and thanks for visiting us here at 50/50.
It's my pleasure. Okay, thanks for the invite.